welcome to Neighborhood News. I'm John Sylvia here with co-host Carlos Cesar. Carlos, back for another show?
Yes, John. Hope everything is okay.
Yep.
I mean, this past week, good weather.
Yeah, good weather. Labor Day weekend.
Exactly.
So summer's over, which is a good thing too.
Yes.
Get some nice cool weather.
Kids
going.
back to school again.
Yeah.
So, and we are back again, and same thing happens every week. We want to welcome the Portuguese community that are listening to us right now. Sejam bem-vindos a mais programa de sua notícias da sua vizinhança. Hoje nós vamos ter aqui em estúdio conosco alguém a falar sobre produtos que estão à venda no mercado e que possivelmente as suas crianças estão a trazer para casa, mas não têm conhecimento do que elas são. E algumas delas fazem muito mal à saúde das suas crianças e também podem ser usadas como um tipo de droga. Só eu queria pedir a vossa atenção para esses produtos que nós vamos mostrar e se alguém tiver alguma pergunta, pode chamar o número que vai aparecer aqui na sua televisão. And I pretty much told the Portuguese community to take a very close look of the show today, because we have something special for the parents that have young kids, teenagers, that we've been going to be showing some stuff that probably it's singing on the house and they don't even know what it is.
Absolutely,
so here's a good opportunity.
Absolutely. So today we have with us Marilyn Edge, who's the director of the Tobacco and Alcohol Prevention Collaborative here in Fall River. Welcome, Marilyn.
Thank you for having me.
Yep, great. You know, Carlos and I are somewhat familiar with this. I still think we're laymen in this, but we have seen you've come to, I know, the Niagara Neighborhoods meeting, and I believe she's also been to the Flint
too, yes.
So I have to say, you have quite an array of items over there.
Oh, thank you.
And
pretty colors too.
Yeah,
all pretty colors. Yeah. Remember that, because that's important.
Exactly.
Pretty colors.
Pretty colors, and I guess the prices are cheap too, so everybody can buy it.
But before we get to those colorful items over there, if you could just let us know a little bit of what you do in this position.
Sure. I've been doing the tobacco program in Fall River now for about 5 years, 6 years. The city had lost its funding back in 2001 with a state budget cut. And then under the direction, when the health department was under the direction of Michael Coughlin, we got the funding back from the state, from the Department of Public Health. So I've been working in tobacco since then. When I started, I was covering Fall River, Westport, and Somerset. And then we slowly expanded the program, and as of July 1st of last year, 2011, I'm now covering 13 communities. So I work full-time. I am a city employee. I work on a state grant. I was a city employee when I took over the tobacco. I used to do after-school programming for the middle schools. And I have one part-time inspector who helps me. We are both agents of the boards of health in all of those communities that we cover. And we do routine inspections to make sure the stores are in compliance with state and local laws, FDA regulations, Attorney General's regulations, provide them anything they might need to be in compliance if they're not. And then we do compliance checks with high school students 16 and 17 years old trying to buy tobacco products when they are too young to be sold to.
Okay, and I know when you came to our meeting, you have some students or some youngsters that are on getting paid to help you in some of this way, which I think is a great thing, because it's a win-win situation, and you're also, enforcing this and showing these kids about this. So I think that was great.
The students I brought with me to both of your meetings are students from the BOLD Coalition over at STAR, and they were paid through a mini grant that BOLD applied for through the Department of Public Health. Our funding in the Department of Public Health is through the Bureau of Substance Abuse. So they applied for a mini grant. High school groups are eligible all across the state to apply for this mini grant money. and those kids they pick a tobacco issue and they work on that issue for 6 months or so. Usually it's a policy change issue. They worked with us on the pharmacy ban last year. And then we take them twice a year to the State House. They get to meet with their legislators, and they do a march on the Common, and it's a whole day event, and we all have a great time.
Yeah, no, they were very good, you know.
Yeah,
They came
yeah.
very good kids. So what do you want to show us here, or what should we
Well,
know?
what I'm going to show you, and what the presentation I did at the neighborhood associations that you were both at, is a presentation that I do for parent groups. I do it for PTO meetings. I've done some in-service training with the police departments. And what I do is I bring the products and I show parents and grandparents what is out there that is not cigarettes for tobacco products, because all of the new tobacco products are not cigarettes. And they're not only smokeless products, but they're also spitless products. So a year ago, if someone said to you smokeless products and you hadn't seen my presentation, you would think chewing tobacco or dip. Well, you'd know if somebody was using it because they'd be constantly spitting either into a soda can or an empty bottle of water. With these products, the product interacts with your saliva and you swallow all of that. There's no spitting necessary. So we're finding more and more students that have access to tobacco products are using these products in school and at home, and no one knows that's what it is because it doesn't look like a tobacco product. There's no smell involved, and they're just as accessible to students as cigarettes. And the reason I say that is there are stores in everybody's community. Regardless of whether you're a city like Fall River or a small town like Somerset, there are stores that sell tobacco to minors on a regular basis. They will sell to kids they know where their parents are, who their parents are, they know where you live, and they've watched your high school students grow up. So they know who these kids are, and they know they don't work for me. I could send a different kid in there every day, and they wouldn't be successful in making a sale because the store owners don't know them, so they won't sell to them. Mm-hmm. So there's no illusion that everybody's in compliance and nobody's in Fall River is selling to kids. That's just not true. Catching them is the difficult part because we can't use high school students in their own community for safety reasons for them because we don't want to set them up to be a target. So if there was somebody that went to your store every day and bought cigarettes and you knew who they were, and then the next day I come in and write you a ticket, it's not difficult for the store owners to figure out who these kids are. So I bring these products, and I'm going to start in the beginning. A couple of years ago, Camel products came out with a snus product. And am I looking? Where am I looking with these?
This camera.
This one, okay, sorry. Camel snus was the first snus product on the market in this area. And it came in a can, and it said sold cold, and it said free tin offer. Well, in Massachusetts, you can't give out tobacco products for free. It's against the law. So what they would do is if you bought a Camel product, Cools or Pall Malls, and the store clerk would ask you if you were interested in trying the product for free, and when they scanned it, it would ring up a penny. It would just deduct a penny from whatever your previous purchase was. Mm-hmm. And that's how they got around the law. So, so the product is, this is called Frost. It's a blue can. There's a variety of different flavors. And then now the new packaging I'll show you. But they're small tea bag like pouches, and you put it either in your upper or lower lip, and it interacts with your saliva. Instead of having to spit all of that, you swallow all of that. So when these products came out, probably 3 or 4 years ago, the Department of Public Health started tracking the rate of sale of these smokeless products and the spitless products, and the rates of cancer of the esophagus, cancer of the stomach, cancer of the colon, to see what the correlation was. Because if you smoke cigarettes, then you put yourself at risk for oral cancer, maybe lung cancer. If you're using these smokeless products, they go through your body just like food would. So it affects every organ in your body. And that was a 5-year study, and they haven't gotten to the end of that yet. So I don't know what the...
Can I ask you, how
Sure.
many, when you opened that, there were like probably 4 or 5 pouches in there?
There's 15 in here.
15? So what would one of those pouches be equivalent to, say, 2 cigarettes, 3 cigarettes, do you know?
The nicotine equivalent in these, from what we understand, is between 3 and 6 cigarettes
3 and 6 for one.
for one pouch.
And how much would that cost?
$2.99,
$2.99?
$3.99, baby.
Okay. So is that, I mean, you know, we know by the packaging, it's marketed to youngsters, but do older folks also
I don't
that,
know
you
anybody who uses these products.
It's mostly
I don't know.
Okay.
I don't know any adults
Okay.
who use these products. This is a brand new package, this Camel Robust package. And as you can see, they got a little more creative with the design and the colors, which is usually how the tobacco companies work when they're looking to target kids. And the pouches in the new cans are bigger than the old cans.
And that's exactly how I started the show talking about, is for parents that's not familiar with this practice, they see this probably on the kids' room and they think it's candy.
Yeah.
You know, it's
Mints,
because
right?
it's mints, it's gum.
Yeah.
Because all the boxes now, you see all the colors and
Yeah.
all of that. For the parents that really don't know, and you know, they can swear that, oh, my kid don't smoke.
Right.
You know, because he never
And
carries
they're-
cigarettes with him.
They're easy to use in school settings as well, because unless the school has a policy against chewing gum or cough drops or any of that, teachers don't have time to stop somebody in the hallway and say, you know, what is it? It's not like they're 5 years old, you know, show it to me. I mean, I can remember saying to my own kids, what do you, spit that out, whatever it is, in my hand. I want to see what it is. But by the time they get to high school, you don't do that
Exactly.
with your kids. So about 6 months after we noticed the Camel products on the market, Marlboro came out with their own snus product. And if you didn't smoke, you wouldn't notice it, because it looks like a regular package of Marlboros. It's in the rack with the Marlboros. And this was the original design. And this also came in spearmint and peppermint flavored. And you just peel back the top. The thing with the Marlboros is there were only 6 pouches. It was a lot cheaper. It was like $2. And from talking to people who work in stores, they would tell me, you know, nobody's buying it. They're not selling any. People don't know what it is, you know, unless the store clerk would say to them, do you want to try it? So Marlboro, realizing they had to stay in the market, changed their packaging to this, so that they identify more with the smokeless, with the chewing tobacco. And it's the same product, and they're much bigger pouches than the original design, but it's the same product, just in a different packaging. So they're identifying more with the smokeless population. So we had the Marlboros for a while, and then we started to find this product. It's called General Snus. And in the stores that carry it, it has its own display case. It's very pretty. This is from Sweden, so it's a little more sophisticated product. And this flavor is called White. And I don't know what that's supposed to be, but that's the flavor. It's white.
You have the candy, right?
And it's a small pouch. And this product is a little on the expensive side because it's imported and because it's from Sweden. So in addition to the tins, they sell these sample packs. and it's in a box that looks like this. Inside this box, there are 4 envelopes, and there are coupons. So this one is wintergreen, and there are 4 envelopes like this that are each have 4 pieces of the product, and they're 4, but each pouch is a different flavor, and there's coupons for your next purchase. And this package was only $1.99. So you're getting 16 pieces of product for $1.99. And I'm not sure how well this sells. Again, I don't know a lot of people that use the snus products. But then Skoal, wanting to be competitive, came out with their own snus product. A lot of the chewing tobaccos are coming in pouches now anyway, but Skoal has, this one is mint, and it doesn't smell too bad, actually. It smells like candy.
Would it be all the convenience stores that are selling these, even the chain stores?
Pretty much.
Even like Cumberland
Yeah.
Farms, it's a chain? Wow.
Yeah.
Okay.
Yeah, these snus products are not just in little mom and pop places. You can buy them at Hess, you can buy them in Cumberland Farms, any place else but Fall River. You can buy them at CVS, but we don't do tobacco in pharmacies anymore in Fall River. So those are the snus products. And then a couple of years ago, the Department of Public Health got an email blast from the Poison Control Center, the National Poison Control Center, from Indiana, because they were seeing people. This product was test marketed in Indiana. This is called Arriva, and it's a dissolvable tobacco tablet. And this particular flavor is wintergreen. It comes in cinnamon, comes in Java, which is coffee flavored. And Indiana Poison Control sent out that nationwide blast because they were seeing adults in the test market area in the emergency rooms with nicotine poisoning. And the reason for that is you can buy this package for about $4 now, and there are 10 tablets. Each tablet has the nicotine equivalent of 3 to 6 cigarettes. And if you work someplace where you can only go out on a break in the morning, go to lunch, go out on a break in the afternoon, you might get 3 or 4 cigarettes in over the course of a work day. If you're sitting eating these at your desk like M&Ms, you're going to make yourself sick because of the nicotine equivalent in these products. Now, last year, the first week of school, I did an in-service training for faculty and staff at North Attleboro Middle School. And as I was passing the products around, like I did at the neighborhood association meeting, a teacher stood up and she pulled this part of this out of her pocket, and she said, "I found one of these in my classroom this morning." It was the first day of school. And she said she didn't think anything of it. She picked it up on her way out the door, put it in her pocket with the intention of throwing it away, and it didn't even occur to her that this could be a tobacco product, because these products are marketed to look like other things.
To me, it looks
Yeah,
like
it looks
gum.
like gum. Yeah, looks like gum to me.
Exactly like gum.
Right. So Arriva, when they first came out, they were in packages that looked like this, that looked like cold medicine. And again, people got creative with the marketing. They weren't reaching the population that they wanted to. They weren't reaching the younger people. There isn't a kid alive who's going to walk around with this in their backpack, you know. So they had to be more creative with the packaging. And although the tobacco companies are under federal regulation not to market to children, it's clear that with the packaging, that's exactly what they do. They target, the tobacco companies target our kids, because there's more and more of the population that smokes either dies or quits. They need to keep the kids addicted to keep their customer base going.
So how old do you have to be to buy those products? Is it 18 also, or?
Well, that's where the state law comes in. It's not illegal, unless your city or town has a regulation against youth possession. And right now, the only ones around here that do have that are Attleboro, North Attleboro. It's not illegal for kids to buy. It's not illegal for kids to smoke. And it's not illegal for kids to possess, unless your city or town has that regulation. It's illegal for the stores to sell to them. So all of the onus on the sale is put on the store. But your kids could go in and ask, and if they're successful and they're not kids that work for me, nothing happens. It's not illegal for kids to buy, which is the problem.
But it's illegal for the store to
sell
sell,
to
though, right?
them.
Because like a
Yes.
cigarette, they have to be 18. Okay.
They have to be 18, and the stores are supposed to ask anyone who they think looks under 27 for an ID. And there are stores that have company policy that they ask everyone. Rite Aid's company policy has always been they ask everyone. They don't care how old you look. If it's obvious you're over 27, they'll ask you for date of birth, but they have to put something in the computer. So if you went to a store like Shaw's to buy cigarettes and they didn't ask you for an ID, I would ask them, whose date of birth did you just put in that computer, because they need to put in someone's. And in all of the pharmacies that we have gotten sales to minors, the clerk has always put in their own date of birth. The first suspension hearing we did here in Fall River was Extremont on Bedford Street. And in 3 compliance checks in a row, they made sales. And on the 3rd sale, the girl who was on the cash register didn't ask anybody. And she had sold 200 packs of cigarettes during her shift and put in her own date of birth every time. So the Board of Health, at a hearing, asked the district manager if they could put a policy in place where if there were so many repeat dates of birth, that it would send an alert to the manager to check to see what was going on. And they've done that. They changed their company policy to do that. So we have the dissolvable tablets, and then we have, usually everybody's favorite, is this Nico Gel. And Nico Gel is it's a 7-Eleven product. That's mostly where it's found. And you can buy it in a box of 10, or you can buy it in individual packets. And this is nicotine-based hand gel. And it's marketed for people to, you would use it the same way you would use hand sanitizer. And you absorb the nicotine through your skin. Because it's 40% extract of tobacco in the product, it's a restricted product. You still need to have an ID. You're supposed to have an ID to purchase. I've had several people in neighborhood meetings try it. They say it smells a little bit like cigarettes, but nothing that you wouldn't notice if you were sitting next to someone using it. But it's marketed for people to use on airplanes, in the office, at the restaurant, or at the movies. I don't know anybody who can't wait.
Well, if you're that addicted to nicotine, I guess, right?
So then the couple of the other products I brought, when Carlos was talking about colors and marketing techniques, these are cigarillos. These are small cigars. This is a Dutch Master Vanilla cigarillos. They're all flavored. They're fruit, candy, and alcoholic beverage flavors. They come in these shiny wrappers. They're marketed to high school and college kids. And their main use is to take the tobacco out and fill them up with marijuana. It's the tobacco inside the cigarillo or the cigar is not what's flavored, it's the outside wrapper that's flavored. So it's very easy to take the tobacco out. If you pull up in a convenience store next to a car full of kids and they're banging out the tobacco, you know there's a reason for that. So several communities, and Westport just did this last week, have passed regulations where they're eliminating single sales of any tobacco products that individually would cost less than $2.50, and they're making them be sold in packages of 4 as of February of 2013. So that will eliminate these products. Some of these products are 69 cents. There's a new one we've seen recently. It's called Chrome. They're 49 cents a piece. And when we took the kids to the State House last year, the whole theme of the day was that tobacco products should not be cheaper than chips. And where it's pretty easy for a kid to get their hands on $1 to buy one. It would be more difficult for them to get $5 to buy a box.
So normally that would be, is that like 2 or 3 cigarettes? Is that what this is?
That's, well, it's considered a small cigar,
Okay.
so they're not, and that goes by the weight of the tobacco on the inside. So they're, I don't know what the equivalent would be between cigars and cigarettes as far as the tobacco, but it's got all the same chemicals.
Isn't there, yeah.
It's got all the same chemicals.
I remember in Portugal, we still have this kind of packages, but it's chocolate.
Oh, yeah. Well, you know,
So the
we have-
Portuguese community are very familiar with packages
yeah.
like this for kids, and the parents buy for the kids, but it's a cigarette in chocolates.
Yeah.
So
well, we had the blunt wraps are, have the pictures. The blunt wraps are banned in several communities, and Westport is the latest one in this area. And it's, blunt wraps are rolling papers that are made out of tobacco products. They're not paper, they're tobacco. And they come in all these watermelon flavors. I had a mother at an elementary school tell me that she was in the store with her son, and he was jumping up and down and being annoying at the register. He wanted a snack, and he wanted this, one of these has a watermelon, picture of a watermelon on it, and she said to the clerk, just give me that, because she thought it was a fruit roll-up. And the clerk said to her, lady, these are tobacco, these are not candy. But they're all, I mean, this one is called Sensual Chocolate, and it's a picture of a woman's legs having chocolate poured on her.
Yeah, I mean, you know, the funny part, and it's not that it's funny, is that I see a lot of those wrappers, almost as many sometimes as the lottery tickets that are thrown on the street. So apparently those are used a lot, definitely.
yes.
And they're used just to smoke marijuana. They're not used. People of our age who continue to smoke pot use rolling papers. They're not into all of the flavored things.
And the week before, she went to the Flint neighborhood with this presentation. We did the cleanup at the Travassos, and I found a lot of those
on the ground.
Yeah. And I thought was the powder to put on the bottles of water,
right.
you know,
okay.
to make
Crystallite.
exactly. So that's what I thought it was. It's wow, this people's been exercising in here and just throwing the wrappers on the ground.
Yeah.
And then a week after, I found out
So,
what it was. So
well, it went by pretty quick, huh?
yes, half
Very
an hour.
quick.
I mean, you still have a bag full of it.
I know.
They shouldn't even go through the other part where they're trying to get this order. Get through that
I think that's a motive for her to come back again.
Yeah,
to talk
absolutely.
about the other part.
I
Absolutely.
can come back with the police department. We can
Sure.
give you a big presentation.
So that will be good. That will be another hour.
Great. Well, give me this. Well, thanks a lot. Appreciate
Well,
it.
thank
You're
you.
welcome. Thanks
Thank
for
you
having
coming.
me.
Well, before we go, Carlos, I know we have another minute left, and I just wanted to mention two things that are happening in the community. The first one is Father Kelly Neighborhood Association is having a family fun day on September 29th from 11 to 4. So if you're in the area there, make sure you go by. And the last thing is the St. Anne's Neighborhood Association, plugging this again, they're having the Kennedy Park Car Show September 30th, and all the funding goes to help their inclusive playground project, and that's September 30th from 10 to 2. So two things that you can be looking out for now that the fall's here. We were talking about two things that folks can be doing in the fall.
Sure.
So okay.
Very good.
Did you want to talk real quick? You got maybe 30 seconds about your
No, we will talk on the
next time.
next week. Next week.
All right. Well,
Very
thanks
good.
a lot. Have a good night.
Thank you.